Quebec is the only province that hasn't waited for NACI to change its recommendation. It's already giving the AstraZeneca vaccine to people over 65, but there's some anxiety.
I'm worried. If I had had the chance to choose, I would have wanted to have the Pfizer one.
My husband refused it, she says, because he doesn't trust it. In one area of Montreal, the health authority says about 12% of people offered AstraZeneca yesterday wouldn't take it. It comes as a growing number of countries have temporarily suspended its use as a precaution after reports some people developed blood clots. But the World Health Organization cautions against panic.
This does not necessarily mean these events are linked to vaccination, but it's routine practice to investigate them.
After touring a vaccination site in Montreal, Prime Minister Justin Trudeau tried to reassure Canadians, saying the vaccine is safe and approved by Health Canada and experts, and that the doses here come from a different batch than those being investigated.
The best vaccine for you to take is the very first one that is offered to you.
The European drug regulator is investigating, but says the number of blood clots in vaccinated people does not seem higher than in the general population, a message people need to hear, says Dr. Christopher Labos.
I think a lot of people will look at that data, look at those numbers and be like, oh, okay, I understand now. I see why I don't have to be scared. Let me go get vaccinated.
As AstraZeneca doses roll out across the country, provincial officials also tried to ease concern.
In my opinion, this is a safe vaccine, and I'm going to be receiving this vaccine.
For some, getting the shot, along with some worry, there's a desire to be protected.
I didn't want to not get it done, and now I got sick and then kicking myself, right?
Europe's drug regulator will meet Thursday to decide if further action is needed. Alison Northcott, CBC News, Montreal.
Okay, now one last word on this. We go to Dr. Susie Hoda, an infectious diseases specialist. And Dr. Hoda, you've been following all the twists and turns of this vaccine. Tell me, what is your bottom line here?
Well, I think AstraZeneca is a safe vaccine to be giving to people, given the data that we have so far. It's been given to tens of millions of people so far. And certainly there's a signal around thromboembolic disease, and it's being investigated as it should be. But the numbers that we've seen so far, 37 cases out of 17 million vaccinated, that's lower than we'd expect in the general population. So I don't see anything concerning at this moment.
Right. So your bottom line, if I'm understanding you correctly, it is a safe vaccine. But there are still going to be people who think, why take the risk? I've waited this long, might as well wait for something like Pfizer or Moderna, where there's less debate over the safety and the efficacy of it. What would you say to those folks?
Well, nobody's going to force a person to take, AstraZeneca or any vaccine for that matter. But, in making your decision, I'd urge people to consider what are the costs of waiting. And, we truly are in a race against these variants of concern, which are taking off in some parts of the country and already leading to a third wave. And our best bet of fighting that is to actually get as many people vaccinated as quickly as possible while sticking to strict public health measures. So, this is what we're up against.
Okay. Dr. Hoda, thanks for your time.
Thank you.